If you've ever experienced a miscarriage, you may be wondering what is the cause. Today, we're going to be walking through a lot of the different potential causes of a miscarriage, and we're going to talk about how common miscarriages really truly are. You're on the Premom channel, and we're talking all things fertility. Our focus is on cycle tracking, fertility, and all those on the trying to conceive journey. So like and subscribe this video, and let's go ahead and dig in and keep talking about miscarriages. All right, for starters, miscarriages are also called spontaneous abortions, and these are actually more common than a lot of people realize. Spontaneous abortions actually occur in 15 to 25% of all clinically recognized pregnancies. Now, the caveat is a lot of women may not even know that they're pregnant before the spontaneous abortion takes place. There also is another condition called recurrent pregnancy loss, which can happen in some women, and this is a condition that occurs when there are more than 2 miscarriages in a row. Now, the reassuring thing about recurrent pregnancy loss is 50 to 60% of the time we can dig in and figure out what the cause of this recurrent pregnancy loss actually is and go in and actually treat that so that you are able to go on and have a successful pregnancy. So miscarriages can occur for a few different reasons. One of the first reasons that causes a miscarriage is something called progesterone deficiency. Progesterone deficiency is what helps to maintain the uterine lining as that pregnancy begins to take place. And progesterone is a really important. Progesterone stands for progestation. Gestation means pregnancy. So it really is pro-pregnancy hormone, and we want to have a sufficient amount of it. Now, progesterone deficiency miscarriages typically occur at about 6 weeks or less because that progesterone didn't quite kick in. Now, progesterone has to be produced by the corpus luteum for long enough until the placenta is able to take over, and then the corpus luteum can kind of take the back seat and the placenta takes the reins and continues to increase that progesterone production. Now, if you're concerned about a progesterone deficiency, you can ask for a doctor to track your progesterone levels as soon as you find out you are pregnant. They're going to take your progesterone levels by blood one day, and then they're going to take it again 2 days later just to make sure that that progesterone level is staying nice and high. If for any reason it's on the low end, they are then able to supplement with progesterone. The important thing to understand, however, is that progesterone is not going to keep a pregnancy around that wasn't meant to stay initially. The only thing that progesterone supplementation is going to do to prevent a miscarriage is to stop a miscarriage that would have happened because there was not enough progesterone present. So while it's not the end-all be-all to preventing miscarriages, if there is any sort of progesterone deficiency, using supplemental progesterone is going to help support those cases of progesterone deficiency. Another cause of miscarriage is also luteal phase insufficiency, and this kind of goes hand in hand with progesterone insufficiency. So luteal phase defect is when the luteal phase is 10 days or less. That means that there's not enough time for that fertilized egg to implant in the uterus before the menstrual cascade begins. So that means that little fertilized egg doesn't have enough time to embed itself into your endometrial lining before that endometrial lining comes off and your period sort of begins. So that can kind of be a cause, and this is often associated with lower progesterone levels as well. This can be assisted with either progesterone supportive medications or even ovulation inducing medications that can help create kind of a stronger corpus luteum to help hopefully extend that luteal phase so that pregnancy is able to stick and be viable. Now, another cause of miscarriage is something called Antiphospholipid Syndrome. Now, Antiphospholipid Syndrome is something that your doctor is able to test for, and a lot of times if you've had 1 or 2 miscarriages, then your doctor's going to start digging a little bit deeper and looking and testing you for this. They could do a lot of blood testing to kind of see what's going on with your body and see what could potentially be causing these miscarriages or this recurrent pregnancy loss. So other causes of miscarriages can run the gamut. It can be anatomical abnormalities. Very often it is chromosomal abnormalities that create basically a genetic mismatch that ends up not being viable. Also, you can have uterine abnormalities that can basically restrict the growth, and that can be an issue where there's not an appropriate implantation and blood supply established, which can cause issues with miscarriages. These are all different things that can come into play And it kind of depends. The tricky thing is when it comes to miscarriages, you can have early, middle, and kind of late miscarriages. And most commonly, they're going to be these early miscarriages. And they typically are, again, associated with that genetic mismatch, which typically means there was an egg that was fertilized, but the genetic material inside that sperm and egg combination just did not end up being viable. Many times, miscarriages have nothing to do with your health or anything that you did right or wrong. In fact, women have about just over a 70% chance of having a fully successful pregnancy after their first miscarriage. So it's nothing to beat yourself up about or blame your partner for. While you're feeling all these kind of emotions that do come with having a miscarriage, it's also important to understand, the commonality of it, not to diminish at all the impact that it has had on you, but it is absolutely common and a lot of women do go through this. And also to understand that a lot of women can go through to have very, very successful, healthy pregnancies after those miscarriages. So when it comes to miscarriages, again, please know it's not your fault. If you had more than 2 miscarriages in a row, it's time to work with your doctor and dig deeper into what could be causing this to be happening. There's a lot of testing that your doctor can run to dig in and figure out if there's an autoimmune issue, if there's a clotting disorder, things like that, to kind of rule out the reasons that you may be having miscarriages and what they can do to actually help treat or prevent those in the future. So if you've undergone a miscarriage, take the time that you need to heal. Contact the resource that you do, love on your partner, and have hope for what is to come. Wishing you all the best. If you have any questions or comments, feel free to leave them below. This is a safe space for the Premom community. We're here to support you, and we are wishing you baby dust and really, really excited for your rainbow baby.